Good evening and welcome to Thursdays with NAMI. My name is Peg Morrison. I'll be your host tonight. I am the Assistant Director of NAMI North Carolina. That's the National Alliance on Mental Illness, North Carolina. I'm so glad y'all are here. Thursdays with NAMI is our way of building conversations and building community around the topic of mental health. This is National Eating Disorders Awareness Week. So tonight we're going to consider this area of mental health that is very misunderstood and pretty complex. What is an eating disorder? We'll kind of start with the basics. It is a mental health condition. So of course, we're looking at a person's thoughts, feelings, their daily activities. All of those are affected. Specifically, there's a disturbance in relation to food, all those thoughts and emotions that revolve around our eating. The person may be preoccupied with diet, with weight, their body shape or size. Sometimes the person will restrict calories and eat very little. That's called anorexia nervosa. Sometimes they binge and throw up, or that's called purging. And in that situation, the person may have bulimia. And then there's just binge eating, which involves a lot of calories, taking in a lot of food as a way of regulating our emotions. I think a lot of us do that, just between you and me. So eating disorders are not a lifestyle choice. Many people want to lose weight, right? But this is a serious thing. This is not just, I need to lose some pounds and I've got it under control. This is a mental disorder that can actually be fatal. So what puts someone at risk of developing an eating disorder? Been lots of talk and research on social media along these lines. 30% of girls surveyed in a Facebook study said that Instagram made them feel worse about their body. What could we change to let teens and young adults, and just all of us, know that our value is not measured at the gym? It's not measured on the bathroom scale. Tonight's guest has published a research article that will shed some light on these issues, how they all work together. We'll be talking with Lorna in just a moment. As usual, the first part of our show will be an interview with our guest. Partway through, we'll show a video of the week, a lighthearted moment for us, and then we'll spend time answering questions from you, members of our virtual studio audience on Facebook and Zoom. All right, now a word from our sponsors. Thursdays with NAMI is funded in part by the North Carolina Department of Health and Human Services Division of Mental Health, Developmental Disabilities, and Substance Abuse Services through the Federal Community Mental Health Block Grant Fund. We appreciate their guidance and support very much. Welcome, Lorna.
Hi.
Yeah, I'm so glad you're here with us tonight, and you're at Durham University in England, so you're not Durham, North Carolina, like some of us might be tempted to think. We always love to hear the background story of our guest. Tell us about yourself in a nutshell.
So as you said, I'm an undergraduate at Durham University. I'm studying combined honours in social sciences, so I'm taking sociology, anthropology and politics. As my kind of research has suggested, I'm really interested in sociology, mental health, and also gender is a really big important thing to me. And I was able to do this research because I was awarded the Laidlaw Scholarship, which is funded by Lord Laidlaw, and it allows people across the globe in loads of different universities to research something of their choice. And I happened to choose this, so that's why I'm here talking about it.
Right. Well, it's such a relevant area. It affects so many people. It's kind of a quiet but really important part of mental health. And I'm just so glad that we can have this conversation tonight during National Eating Disorders Awareness Week. And you mentioned you've had a passion for helping folks who have struggled with body image or their relationship to their body during the pandemic. What sparked your interest in this area personally?
I think because going through the pandemic was such a life-changing experience for everyone. I think that's almost a universal statement that we could all agree with. And lots of people spoke about mental health changes and attitude changes. And one area that I thought that was really neglected was talking about weight and health and how we like how our relationships to food change, specifically when talking about loads of people spoke about how they lost weight during the lockdown, how they got in shape, and there seemed to be this almost resurgence of acceptance of negative thought towards our bodies. And I think what really put it in place is I've always been passionate about looking at stuff like eating disorders or disordered eating. Because again, I think everyone will have a stroke of disordered eating or struggles with their body image at one point in their life. Unfortunately, probably because of social media, that is almost a universal experience as well. So I just wanted to apply it to the lens of the pandemic, see how the heightened social media state, but also the heightened state of health and anxiety towards health kind of changed our relationships with our body and food.
Mm-hmm. There's a comment I've heard in recovery circles that it's important not to compare your insides with other people's outsides. And I notice on social media, it's so easy to do that, you know, we post our best moments. We don't post the moment when we're crying at home alone. And if you take that at face value and assume that that's all other people experience, of course, you're going to feel very disenfranchised, very less than, I guess you could say.
No, exactly. I was speaking to lots of my interviewees, and all of them mentioned they felt that they had to kind of present themselves in the best light on social media. And they said that they felt it became almost competitive, which has been shown, especially within anorexia nervosa, that competitiveness is such a key symptom. So that's why I was so interested in just to see like how social media had heightened individuals' attitudes towards food and their bodies.
That makes perfect sense. Yeah. And it strikes me with young people. Of course, I'm old enough that I grew up without social media. It was not a factor. But today's young folks in high school talk about, well, my brand, what would that do to my brand? And I want to make sure that I present this way because of my brand. I'm not sure I knew what that word meant when I was that age, much less applying it to myself. So it is a different world. And I think it deserves a lot of attention. How does this different world impact young people's mental health?
No, definitely the amount of people, when I asked them like, why did you want to lose weight, or did you have a motivation, they said, someone said to me, oh well, it's my birthday coming up, I want to look good for my birthday in the pictures that I post on social media for my birthday. And I was like, well, it's not just for your birthday though, is it? Because that's not what you focused on there. You then focused on social media, how it's important to look good. And then they mentioned how they continued to restrict eating and focus on exercise. And I was like, well, why did you keep doing it? And they were like, well, I wanted to keep up the appearance for social media. And when I just asked them, well, that's kind of strayed away from just your birthday now. It was like, well, it was kind of noticing how, as you said, it's kind of like a brand people build, and people feel like they have to maintain it. And I was just, yeah, it was really sad to actually talk about, but really interesting at the same time.
I'll bet. People were very candid with you from the sounds of it.
Yeah, I was really lucky. I got to interview people who were at my university who are basically my own age. And I think because lots of it was almost a universal experience that we all had together, there were so many similarities between their experiences, but also my own experience, that it became so easy to connect with them and just chat for 45 minutes to an hour about any experiences that they had. And yeah, it was really good. It was really enlightening. It was really good.
Yeah, it sounds like it. I enjoyed the article too. So you completed a whole research paper on the mind, the body, and the pandemic. Tell us about your process, your methodology.
So like I said, I interviewed people within my university. I put it out on Facebook. So participants came to me and asked if they could join in. So it wasn't forcing anyone to talk about what they didn't want to talk about. Beforehand, I just asked people to let me know what gender they identify with, because then I held focus groups as well, which is just small like interview groups that was defined by gender. I ended up only having male and female participants. So I ended up having male and female focus groups. But yeah, I held a semi-structured interview focused on 3 questions, and that was just, how has your relationship changed towards food? How has your relationship changed towards exercise? How has your relationship changed towards social media? And then just asking them to maybe find links. But lots of the time, they automatically just found links for themselves, because it almost was quite a reflective process. And then the focus groups allowed everyone to kind of come together who were of the same gender, so I could kind of compare different experiences, but also so they could meet other people and chat about it, because I feel like not many people talk about their problems with eating anyway, let alone during the pandemic, which was such a difficult time. And as we've said, people trying to keep up brands on social media, people are shying away from saying how bad they actually felt during the pandemic. It's more, look, I've grown this lovely thing in my garden, or I made banana bread today. So yeah, it was a good process. It was a lot of interviewing, a lot of sitting down and talking with people, all held via lovely Zoom, which I'm sure we're all very, very good friends with by now. And then writing up and analysing it. So yeah, it was pretty simple, really.
Mm-hmm. It sounds like as a result of your research, you gave people permission to talk about something that maybe they hadn't had an outlet for that before.
Yeah, lots of responses I got when I first put the advert out on Facebook. I also emailed it around to different universities. Was that people were really interested in actually just talking about it and sitting down and talking about their own experiences with the pandemic, but not just about, oh, it was really scary because I could have got COVID. More, oh, well, actually, it changed me in so many ways. It changed how I view myself. And that's what I really wanted to focus on. It allowed me to reflect as well, which was an incredible experience, very moving as well.
Mm-hmm. It seems like a good time for me to point out NAMI support groups serve a similar role in people's lives. If you are someone who lives with a mental health challenge, you generally, not you, Lorna, although you'd be welcome, or have a loved one who has a mental illness, we have support groups, both virtual and in person, throughout North Carolina. We cover about half the counties here. Of course, virtual, you can join anytime, whether you're in that location geographically or not. And you will find a space where it's okay to talk about things that normally we just don't discuss. How are you coping? How are you managing? What are some techniques that work for people to get through difficult times? Because the pandemic, as you said, Lorna, has brought a lot of difficult times. So that's enough for my public service announcement. You published your results on a website, a UK website dedicated to sociology. Congratulations.
Thank you.
Yeah. And in the article, you mentioned that folks felt pressure to redefine themselves and exercise more during COVID. What do you think created that feeling, and what kinds of pressure did people experience during that time? We've covered this a little bit, but maybe there's something to add.
Yeah, like we've already said, social media was a massive influence. What I kind of wanted to investigate to begin with was if having actual COVID, like the actual risk of COVID, was by any means kind of this influence of trying to get fit. And I kind of found that it wasn't. The kind of risk of getting COVID and the risk of being unfit and how you would deal with having COVID didn't seem to change people's perceptions of fitness very much. It was instead this idea that was pushed by loads of magazines in the UK, I'm sure in America as well, about coming out of lockdown, like glowed up is kind of the terminology that people used, where you had like good hair, you had new worked out body, you looked amazing. And it was this idea that coming out of lockdown would almost be a transformative experience for everyone, almost like a butterfly coming out of a cocoon almost. So yeah, it was this thing pushed by mainly social media that lockdown was a time of change, and if you didn't change, then you have failed the pandemic somehow. But yeah.
I could see responding that way to that kind of messaging from social media or other just traditional media, that the pandemic is this great opportunity. You can focus on you and redesign yourself, redefine yourself. And it's a test that you can pass or fail. That resonates. I didn't realize that you had started out with another kind of theory that you were testing, and that's not, you just didn't find evidence of your original theory, but you found something that's really quite interesting and relevant.
Yeah, like I was kind of investigating. So in the UK, we have the NHS, the National Health Service, and there was a lot of campaigns going around about like obesity and how that was a really big problem with COVID and how that meant that you were more likely to get really ill. And particularly at the beginning when we didn't really know what the risk factors were, we had everyone over 50 isolating. And I was just wondering if this kind of like idolization of health and keeping safe, if it sparked anything, if it kind of triggered anyone to kind of go into this, focusing on their health all the time. Because I know I was washing my hands all the time till they were red raw. And I was just, I'm sure everyone else was. I wondered if there was at any point we kind of stopped to look at ourselves and just go like, I need to keep healthy. So yeah.
Right, exactly. I was waving my hand like, yep, I did that too. My hands, I come from a hand washing family anyways. My sisters and I used to joke about how much we washed our hands. So this even upped the ante.
Yeah, no, it was, I asked a lot of people about it and they said that it wasn't really a thing for them anyway. And if it was more of a separate thing. It didn't kind of lean into their habits with eating and exercise. That seemed to be an almost separate thing. However, it was the lockdown that triggered it rather than actual COVID-19.
Mm-hmm. Sure. I mean, a situation that creates anxiety and uncertainty and isolation, that's a perfect pressure cooker for the kinds of things that will lead to any mental illness. And then you throw in the branding, the body pressure that people feel. I think we're leading into our next question a little bit. What were the expectations for men versus women? They were a little different.
This was so interesting, and I'm so grateful to all of my participants to like talk about it, particularly male participants, because I didn't get as many as female, which was kind of to be expected with this topic, unfortunately. But it was so interesting because I had a couple of male participants speak to me about when they did want to change their bodies, it was to become more muscular. When they were restricting their eating, it was restricting certain foods in order to put on weight. So they would focus on eating protein, eggs, focusing on eating as many eggs as they possibly could in the morning or something like that. Whilst lots of the girls were talking about kind of following different kind of protocols and different weight loss journeys to lose weight, to look skinnier, to not necessarily get abs, to not get muscles, but instead to become a smaller dress size. And again, it almost seemed kind of like predictable, but it also wasn't in the same time, because at that point, society's told us that we've moved away from all these patriarchal norms, and people don't feel that way anymore. However, just to hear people, oh, why did you want to change your body? How did you want to change your body? And there was such a strong differentiation between women and men between what they wanted to look like. And it was women wanted to look beautiful. The word beautiful came up so many times for the girls I spoke to. And it was strong and masculine that came up for the men when I spoke to them. So yeah, it was kind of it was almost a bit of a wake-up call, because third wave and fourth wave, if there was a fourth wave, feminism has told us that body standards have got a lot better, But this, right down to the core, almost when we weren't out in society at all, almost has shown that it's not completely that still, that a lot of disordered eating is still based on really, really patriarchal stereotypes of body image.
Sure. And when you said beautiful, for that stereotype implies or assumes that that's a certain body type too. So what was your call to action? Tell us about your research results.
So basically just kind of like, this could have been prevented. This kind of, I would call it a silent epidemic, but I feel like that would probably be a bit too bold of me to say. But this could almost be prevented if there was more measures put in place for mental health during the pandemic. There was a lot put in place anyway, and I understand it was a very difficult time, but there was such little understanding on behalf of media outlets and on behalf of just general society of what everyone else could be going through. And if there was just one single message about, just be aware that, you know, eating disorders and disordered eating does exist, here are some prevention methods, have a chat to your family about eating, that, you know, it so could have easily been prevented. But also something as simple as, I don't know if you had it in America, but in the UK we weren't allowed to go shopping multiple times a week. We could only go once a week, and a lot of my participants noted that that caused a lot of binge eating. So something as simple as the government kind of lessening that restriction, but enforcing masks and the amount of people in supermarkets, could have really, really changed people's attitudes towards food and could have prevented a rise in binge eating and also probably bulimia. So yeah, stuff like that is kind of like what I was thinking, more prevention rather than just trying to fix it now it's happened. Yeah.
Yeah, that does make sense. We didn't have a shopping restriction quite that specific. Many businesses were closed, and you were advised to cut back and stay in as much as you possibly could. That's interesting. I also thought about unintended consequences, that when you tell people, you know, the focus on obesity and the messaging on obesity, to think about, you know, what's the corollary, what's going to happen as a result of that message. So I think
yeah, it was definitely like a massive thing. And even, I'm sure you had it in America, I'm sure it was almost a universal thing, where supermarkets were wiped out of basically every single type of food. So
yes.
then you know, the government was telling everyone, please eat healthy, look after yourselves. And it was like, well, there's nothing in the supermarkets, what do we do? So then there was this already panic about food anyway going on whilst we're still being told, be healthy, look after yourself, as well as a pandemic. So it was almost, yeah, I just really wanted to explore why that actually happened and how that actually made people feel, because I feel like that was such a big part of our lives for such a long period of time, and it's almost been overlooked, which is why I wanted to look into it a lot more.
Wow, that's a lot, great insight, I think, that you had there. I think you've covered that question. So what specific call to action do you have for social media in terms of body image and mental health? What specific changes would you like to see there?
I think one of the biggest problems with social media is that it is almost an uncontrollable force that we kind of have to just live with in our society. I don't know if there's necessarily anything that we could like necessarily enforce. However, things like hashtag thinspo and hashtag to do with like eating disorders and becoming thin and weight loss, I feel like that would kind of limiting that, restricting that, and more overlooking exactly what's going online does need to be done anyway. So just stuff like that. I don't know if there's much we can actually do, but definitely talking and educating people more on social media about how it is just, you know, people's best image. Like, not everyone looks like that 24 hours a day. So something along those lines. Again, it's just such an uncontrollable, reconcilable force. I just don't really know what to do. But I guess that's what the call for action is, just trying to see what we can actually do. So yeah, I know it's not really a solid answer, but probably just overlooking what actually is going on social media and wider education on the power of social media, and hoping that can prevent something. But yeah.
It was a big question. It was a big question. I think I like your message of take it with a grain. It's what people are choosing to put out there. People don't put their vulnerability out too often. So that's helpful to me. Comments on the chat box. This is fascinating, Lorna. That's from Gary. And social media is so very overwhelming. Our intern Paulina Mendez added that comment. So thank you for your feedback, folks in the virtual studio audience. What else should we know about your research? Are there any updates? Anything else that comes to mind?
Not necessarily any updates, but I will be, hopefully, fingers crossed, pandemic permitting, coming to North Carolina to kind of continue it / follow it up by I'll be holding, hopefully pandemic permitting, different kind of workshops at different clinics in North Carolina near Chapel Hill, and I'll also be shadowing some of the research at University of North Carolina's Eating Disorder Research Institute on whether eating disorders are genetic, if there's any genetic predisposition to them, which I think would be also really, really interesting within the pandemic, to see if the people who did fall into the habits of restricting or relinquishing control, if that kind of is to do with the genetic thing.
Yeah, absolutely. Keep us posted. And that was a big outcome too, is that folks were either giving up control of food or really fiercely holding on to control of food. Tell us more about that.
Yeah, that was my main conclusion. I had one of my participants, which has kind of become like a really important quote for my research, was that it was like a comfort blanket, a self-destructive comfort blanket. And I just think that really, really beautifully encapsulates everything that anyone has ever said to me about their experiences, which was, to them, having food, restricting it, was so comforting because everything else was out of control, or being able just to eat when you want, whatever you want, because everything else is outside is going crazy, was comforting. And it did seem to be almost a binary experience where my participants didn't really kind of go in the middle. They seemed to be very restrictive or very relinquishing control. And then lots of that fed into their exercise, and lots of it fed into what exercise opportunities they did have. I had a couple of participants talk about how they didn't really have a local park to go running in. They didn't really have anywhere safe to go cycling. And they couldn't afford at-home workout equipment. So they couldn't really do the at-home workouts. They couldn't go on that daily walk because they lived next to a motorway. So a lot of that also influenced whether they relinquished control or restricted control. But no, it was so interesting. It was really, really interesting to see. And lots of participants noted that when they kind of came out of lockdown, this control that they had been either holding on to really tightly or kind of just completely lost, almost came back to a normal level, because they were able to go out again. They were able to see friends again. They were able to actually do stuff without thinking about how pinnacle their meal times are in their day, which was really, really interesting. And a couple of participants from that then said, because the UK has been very lucky, we've had a couple of lockdowns, they mentioned that when another lockdown came around, this behavior resurfaced, which was really, really interesting.
Mm.
But yeah, that was my main finding, that people either restricted eating or kind of comfort ate their way through the pandemic.
Mm. That is a brilliant quote, that food became my self-destructive, we would say security blanket here in the States.
Yeah,
Blanket.
yeah. It was, I mean, it really resonated with me. I think it resonates with almost everyone who's probably ever, it was just, I was just like, yeah, no, that makes a lot of sense. A lot of participants spoke about how food, actually all of them spoke about how their days were planning what meals they had or didn't have. Lots of them spoke about measuring out certain amounts of food. Prepping for meals was really therapeutic for them, but it also meant that they were then seeing how much was going into food, so they were able to control it even more, which was really interesting. So yeah, like they said, it was therapeutic for them, but it was also very, as they've said, they were highly aware that it was also very self-destructive. So yeah.
Such a mixed bag. I have a close friend with anorexia who describes it as being like an addiction. And of course, they have food addiction support groups, at least in the States, they do. So you can stop drinking, you can stop smoking, you can stop doing a lot of things, but you can't stop eating. So such an interesting dynamic.
I think, yeah, especially when the whole health rhetoric was very enforced everywhere, suddenly having a bad relationship with food was kind of out of the question, because we all had to be focusing on if we were washing our hands, not if we were eating properly. And if we weren't eating properly, then we needed to make sure that we were, so we didn't get COVID and didn't get ill. So yeah, it wasn't taken necessarily as seriously, say, as we've already mentioned, like smoking, alcohol, anything like that.
Right. All right. So what kinds of feedback did you get when your study was published?
So my supervisor, who is one of the most loveliest people on the planet, was very excited. And she was just very like happy that it happened. From the actual place that I published, when we were editing, they just kept saying it was really interesting, that they hadn't really heard of anything like this before. And that's why they wanted to publish it. In terms of critical feedback, I'm yet to receive any yet, but I would definitely welcome it, because again, it's such a subjective area of study. Everyone's experiences, you can't claim there's a universal experience within the pandemic. So again, which is why I implore and encourage more research to be done. I'm just an undergraduate. There's not much I can actually do just yet. I need to graduate and then get my master's and then continue. So that's another 7 years of education for me to go. Which is why I implore that research is continued in order to create critical feedback, so we can actually truly understand the nature, the relationship between like disordered eating and the pandemic.
Very good. Is there anything you'd like to add about your study or your concerns about social media, body image, mental health?
I think I've covered everything. But I'd just like to reiterate that, as you've already said, that NAMI's got loads of amazing resources. So if anyone needs any help or anything, find anything that I'm talking about triggering, please do follow all the links and stuff, because I'm aware it's a very sensitive topic. So yeah.
Very sensitive. What gives you hope?
Lots of things give me hope. I just think seeing my friends progress, seeing how they're all doing, seeing how much I'm starting to understand the world, seeing my relationships grow with people. I just think small things, really, just nice small things like the sunsets, sunrises. Yeah.
I think when I talk with young adults like yourself, that gives me hope. just like so articulate and thoughtful and good-hearted. It really does come through. So I'll share that with you.
Thank you so much.
Of course. We are now going to wrap up the interview portion of our show before we move on to our video of the week. A big shout out to our heroes working behind the scenes, our intern, our fabulous intern, Paulina Mendez on chat, psychiatric nurse Gail Pruitt on Facebook, and executive director Gary Kreitz for always being there. So supportive. Thanks to all of you. And of course, our deepest thanks to Lorna for spending not just your evening with us, but your like midnight to 1:30 a.m. hour in your time. All right. So now for our video of the week, we try to add something a little bit more lighthearted. And so what I'm going to show you is one of our mascots that we've had in the past of NAMI, North Carolina. This shows Roxy, the Beagle American. Get a little Roxy fix, a little cute dog fix. Can't go wrong with that. Okay, now it's time for us to take questions from you. I see we've got a few lined up in the Q&A box. If you're newer to Zoom, you want to look for the Q&A icon on the bottom, sort of towards the left of your screen. And we would love to answer your questions. We meaning Lorna. This is from Gail. Were the subjects in your research study white men and women, or was there some diversity in cultures?
I'm not sure if I can disclose that. I'm not really sure. But there was diversity, and it was just uni students in the northeast of England. So unfortunately, it wasn't as wide as I would have liked it to be. Again, definitely like different people's experiences, particularly diverse experiences, would be really, really important to look at. But no, it was just students in the northeast of England, unfortunately. But yeah, whoever Durham attracts, really.
Well, I think that's a wonderful foundation, and other people can look at your research and behaviors that happened during the pandemic, the pressure people felt and how it impacted them, and the fact that it seemed to ease up when the lockdown ended. It's a very interesting start you've got going. Next question from Gary. Eating is inextricably linked to all major social events, from the meal at the christening of a baby to the wedding reception to the funeral dinner. Can you give your thoughts about how eating disorders might either create social connections or cause social distancing?
That's an amazing question. I mean, I think it can cause both. Eating disorders in themselves are a very complex phenomena, and almost the experience, as I noted in my focus group, but also the experience that I had, and then the connection I had with my participants, almost built this really strong rapport and built this kind of great foundation to discuss our experiences and then kind of go into our findings about our disordered eating experiences during the pandemic. But then also at the same time, they really do tear people apart, as we've spoken about before, where addiction to food is not taken necessarily as seriously. I mean, I don't really know of any food addiction services in the UK anywhere near me anyway. So the kind of different attitudes towards food and the normalization of how important it is within our lives means that when one goes through the experience of having disordered eating or an eating disorder, making connections with those who have also gone through the same experience is easier. However, when trying to describe that experience to someone who may not have gone through that, it's probably more difficult and probably causes rifts in social ties. I hope that kind of answers the question. That's just such a really, really good question. Yeah.
That was a good answer. I think you sort of captured the nuances that of what people experience, and I know the friends I have who live with eating disorders have told me it's very difficult for them to go to a restaurant and be at a social event and have people ask them why they're not eating more than a half a slice of pizza. It does cause a lot of anxiety. That's a really good question. Thank you for that, Gary. And from Gail, is there a body of research around the topic of social media, quote unquote, forcing people to put their best selves forward?
I'm sure there is. I can't think of it off the top of my head. However, there's been a lot of research, feminist research, on how social media affects girls' interpretations of themselves and their bodies, and how they feel they have to portray themselves to wider society. I know Naomi Wolf wrote The Beauty Myth. I know that was written before social media really kicked off, but I mean, that encapsulates lots of the arguments and debates that are still within society today. And I mean, that book itself inspired me to complete this research. As for just a specific one, I can't really think of any. I'm really sorry, but I'm sure there must be somewhere, because it's such it's almost evident, and feel to lots of people it's almost obvious. So I'm sure there is. Yeah.
Well, that's what you get when you publish an outstanding research paper, that people are going to ask you questions that are kind of tough.
Yeah.
So comment from Facebook, Alice. She said, brilliant interview, and I'm looking forward to seeing how this research progresses. And that is fine. Thank you for your answer. Okay, from Gail. So with the people you interviewed who restricted their calories, what types of food did they restrict?
It varied from person to person. Again, we spoke a lot about TikTok trends and TikTok foods. And I kind of wanted to see if that kind of spurred anything. And lots of people spoke about when they did try recipes and try any kind of cooking. They did try out TikTok recipes. So whatever was, I would have to say as a general answer, whatever was trending on TikTok that week would be what they were kind of restricting or eating. In terms of like, I guess the normal kind of like, not, a couple of people mentioned not having a packet of crisps, but then a lot mentioned going on a keto diet as well. But yeah, to be honest, it was mainly whatever they could kind of see on TikTok, whatever influenced on TikTok. Yeah, well, I mean, I tried to make all the cloud bread and all that stuff as well on TikTok. I've got loads of TikTok recipes saved myself, so I completely understand. But yeah, TikTok seemed to have a massive influence on what people ate and what they didn't eat, which was really interesting.
That is fascinating. Behold the power of TikTok. Okay, this is very eye-opening for me, and apparently based on the chat comments for people in the audience. Thank you for your questions, everyone. From Paulina, can you shed some light on the difference between eating disorders and disordered eating?
Yeah, I'll definitely try. I just want to make clear I'm not a professional. I'm just an undergrad that happens to be studying sociology, and I have a passion for mental health research. But eating disorders, I believe that they are more commonly labeled and diagnosed. So it would be a repetitive pattern of behavior that fits within a certain category of symptoms, say, for example, anorexia, bulimia, binge eating disorder, etc., etc. Whilst disordered eating could just be habits or patterns of eating that might not necessarily fall into these categories, may not necessarily be, they might not necessarily last as long, they might change over time. And yeah, so they're not often diagnosed. I don't know if that's right. I hope it's right. That's at least my understanding of it. But it's, yeah, abnormal patterns of eating that aren't really diagnosed.
Sure, that makes a lot of sense. You can have maybe symptoms of a mental illness at times. That doesn't mean you have the mental illness.
Yeah.
Yeah. So, okay. So thank you for that question and answer. This is a lighthearted question from Gary, who's a big, as you would say, football fan, as we would say, soccer fan. Do you have a favorite Premier League team? I am a Crystal Palace fan. Not me, that's Gary speaking.
I don't follow football. I'm really sorry. But I'm from Norfolk, so I'm gonna have to say Norwich, Norwich City, the Canaries. I'll have to say that one. I've never heard of anyone being a Crystal Palace fan. It's not really awesome. A thing. So
well, Gary's a trendsetter, so he'll go ahead and make it a thing. And there's a group apparently in the Triangle. We live in the Triangle area of North Carolina. 3 universities, 3 cities.
Oh, right.
Right. And soon you'll be on our stomping grounds. Apparently there's a fan group here, and maybe you can check them out and sell them on a different team. or not, since Gary's my boss. Let's go with not. There seems to be a lull in the question, so I'll go ahead and make some announcements. Thanks again, everyone, for being here. When you close out of this Zoom, if you're on Zoom, you'll see a survey magically appear. Please fill out the survey. Let us know what you liked about tonight, that being Lorna's portion, and what we could have improved on, that being my portion. That helps us keep our grant funding. It helps us improve over time. We appreciate your feedback so very much. Also, if you'd like to be a speaker on Thursdays with NAMI, fill out the survey and let me know your contact information and what you'd like to share. If you have a story or an area of expertise, I'd like to hear from you. We're always looking for new ideas and new trends to explore. And let's see. Okay, and we've got some folks who would like to connect you with researchers at Duke University, so that Duke can also have an opportunity to learn about your research and connect with you.
Yeah, that would be amazing. Yeah.
Yeah, we'd love to follow up with you. We'll talk more after this show, since you'll be in our neck of the woods at some point, hopefully this year.
Yes, fingers crossed.
Exactly. I don't see any more questions. We go as long as the questions take us. Do you have any sort of closing thoughts or closing arguments you'd like to make?
No, thank you so much for having me. Thank you for having me during National Eating Disorders Week as well. And everyone just stay safe and look after yourselves. That's all I can really say.
Absolutely. Well, it's been an absolute pleasure, Lorna. I'm so glad you reached out to us. I think it's been a wonderful conversation that we've had tonight. And to all the folks who are out there in Zoom and on Facebook, thank you for being part of our community tonight. I haven't met too many people who just are great with their body image, who love themselves every single day just the way they are. But if we come together, we can be there for each other, and we might just discover the power of that inner beauty that comes with friendship and helping one another, and the conversations that we have when we can be authentic and vulnerable. If you're feeling alone, please reach out to NAMI, join a support group, be part of the community where we all get it. Check out NAMI in your community. So thank you so much, everyone, for being here. Have a great night, Lorna, and have a great night, everyone.
Thank you.
All right, cheers. Bye-bye.